Greetings. I'm Doris Grinspun, the CEO of the Registered Nurses Association of Ontario, RNAO. On May 9, the first day of Nursing Week, we released a landmark report, Mind the Safety Gap in Health System Transformation, Reclaiming the Role of the RN. It is an analysis of three aspects within the health system. First is an analysis of the minister's proposals for putting patients first. Second, it takes a look at health human resources in nursing and the aspects of skill mix and nursing models of care delivery. It then takes and compares and contrasts those two with the minister transformation agenda. And it brings us to a shocking reality that skill mix changes in Ontario and nursing models of care delivery are running counter to the proposed recommendations of Minister Hoskins for health system transformation. For example, there is a rampant replacement of RNs with less prepared healthcare professionals in Ontario. Let me give you some of the statistics. Between 2005 and 2010, we had in Ontario 3 registered nurses for 1 registered practical nurse. That number declined steadily, and we come to 2015, and in 2015, we had 2.28 RN for 1 RPN. This cannot be the case when acuity is increasing in our hospitals, when we are trying to discharge patients sooner and sooner to their home, therefore they are more acute at home, and when both the age and the complexity of people in long-term care institutions is much higher. Then, if that was not bad enough, we also have a renewal of models of care delivery that we left back then in the 70s. Models that used to be called functional nursing now are being disguised under the name of team nursing, collaborative practice, and the such. These models are nothing else but fragmented care. They take a patient and fragment the patient in different components and let the RN do an aspect, the RPN do an aspect, and the unregulated care provider do an aspect of the same patient in the same shift, knowing that nobody knows the patient. How is that possible? At the end of the day, colleagues, at the end of the day, politicians, we are all here for one thing, to put patients first. But this type of models of care delivery and the skill mix we are now observing put patients last. That is why RNAO has a set of 8 recommendations for government and its agencies. First, we are asking that the ministry must develop an interprofessional, comprehensive health human resources plan. Until that plan is completed, Ontario needs a moratorium on nursing skill mix changes and on faulty models of nursing care delivery. We also need the LINs to mandate the use of models of nursing care delivery that advance care continuity and avoid fragmentation. Ontarians deserve better. Next, Ontario needs an all-RN nursing workforce in acute care for tertiary, quaternary, and cancer care centers within 2 years. And we need within 5 years large community hospitals with 100 beds or more to also be an all-RN staff. These organizations are already providing care for very complex Ontarians. They will be doing more so with the minister's proposal of moving more care into the community. Next, all first home health care visits need to be completed by an RN. Already, when you go to homes, you see patients with very complex care needs, with unstable situations. Those patients are best served by an RN to complete their first assessment. That RN will decide if next it continues with an RN or is triaged to an RPN, or in fact, if an unregulated care provider can continue with the care. 6, nurse practitioners must be enabled to practice to their full scope of practice. Enough with handcuffing nurse practitioners and preventing Ontarians from gaining to their expertise. We need nurse practitioners in intraoperative care. We need nurse practitioners in admission, treatment, discharge, transfers in hospitals, not just in a legislative capacity, but in actual practice, so Ontarians can gain from their expertise and care. 7th, the minister must legislate minimum staffing standards in long-term care. What we are asking here is serious. 20% RN staffing, 25% RPN staffing, and no more than 55% unregulated care providers. Yes, we do all we can to keep people and support people to remain in their homes, but there comes a time when not everybody can do that, and then these individuals make a long-term care home their new home. Well, let's make sure we give them a home that is safe and that continues to protect both their dignity and their health. Last, we are again asking that the 3,500 care coordinators that currently work within community care access centers be located within primary care. Yes, we are in agreement that the LHINs are the ones that will be the main employer, but their location in primary care is critical if we are going to both give care to Ontarians from beginning to end in a coordinated way, and also enable these care coordinators to be part of interprofessional team, therefore boosting primary care to what this country needs to be a high-functioning system. Colleagues, let's move together. Together we can make it happen. The proposal of the minister is bold, it's visionary, but to get there it needs the fuel of the health human resources that will enable the best health outcomes for Ontarians, both in terms of health outcomes and in terms of financial outcomes. The evidence is there. Let's move with the recommendations of RNAO. Thank you.